and you spend like 25 years like that. 25 years like that. Sorry for the curse.
Effort?
Yeah.
Really?
Sorry for the effort.
I'm not even saying that. Oh, it's you again.
It's me again.
What actually is a tummy tuck? Is it just fat removal?
Tummy tuck, you might think that it is just a fat removal, but actually it is designing someone's tummy area all over again. So it's like taking time back, and it's like giving you a time travel back, especially for the patients who has many kids.
For many kids.
Yes, but also if you are overweight or you're losing weight, if you have a saggy skin on your tummy area, you can have the tummy tuck, but it is really awkward to call it just as a fat removal. It's not a fat removal surgery. It's like designing the tummy area and the sides all over again.
A tummy tuck is when you tuck the tummy. Where exactly does it go?
Well, most of it we throw it away, and the rest we are tucking it in. Actually, we are like tucking it in, and yeah, it might sound a little bit different, but usually it's like you're like a tailor who are trying to design a suit.
Little bit different.
Little bit different, yeah, exactly.
Does the belly button know what's happening, or does it just find out later, just like the rest of us?
Yeah, it is. Yeah, the belly button, you have to whisper it before I know, of course. We know where to put the belly button at first place, but of course the belly button doesn't know where it is going. So about the belly button, we are always trying to aim to create the best look, and it is called the slit-like belly button. So it's thin, narrow, and for the eye, it attracts you aesthetically.
They don't know where to go.
Yeah, if you ask to belly button, of course, it doesn't tell you that where it is going to be, but I know where it is going to be exactly. It's 10 centimeters from the pubis area. Also, sometimes you can define it in between the two anterior iliac spine. We call these little bumps.
Still have to pass to another question.
Yeah, however you like, of course.
Thank you. You're a gentleman. Do you, as a surgeon, ever argue with stomach, or is it move of a silent breakup?
For the stomach?
Yeah.
Should I talk to stomach? I don't know. I don't talk to stomach.
Or it's just a silent breakup after you cut it off?
You know, I don't touch stomach. I just touch the tummy skin.
Oh.
Yeah, exactly. So I have nothing to do with the stomach. I don't tell anything to the stomach, but if you ask me that if I speak to the tummy region skin, yes, I talk to it. I tell it that I'm going to remove up to an extent. Be prepared for it.
Can I pass you another question?
Yeah, all up to you.
It's up to me, I know.
Yeah, exactly.
Can you really not stand for a while after the tummy tuck surgery?
After some tummy tuck surgeries, yes, definitely. Your knees and your legs are shaking, to be honest, because yesterday I operated on a patient and I have removed 7 kilograms of tummy. Yes, it's like 2 babies born at once from a person. It's like 7 kilograms.
So she gave a double birth?
It's something like that. Exactly. So this was a post-bariatric patient. So he got the sleeve surgery first and then this.
She must feel so skinny now. Is there any moment in every operation where you think this is irreversible now? Or does it only happen to the patient?
Well, this is, yeah, like never you have to say. Well, it's very hard to answer. This question is very hard to answer. But I have never said, thanks God, something is irreversible. But patients, sometimes they are not satisfied with the result. They might think that it is irreversible, but when they are applying us for the next time, because we are doing the revision surgeries and we are doing it until the patient is fine, then they will see that it is reversible for us. You should be always with the patient's side, and you have to listen to him or her, and you have to support, and you have to exactly explain them that every result can be reversible.
Does the body ever disagree politely?
Yes, sometimes, you know, People always say that you have to listen to your body, okay? It's more applicable for plastic surgery because I have to listen to the skin I am dealing with. I have to listen to the muscle I am dealing with. If the surgery is not going that well, or if the surgery is not going in a way that I am doing, then I might have to change something. In the surgery, I sometimes give different decisions, but at the end of the day, I see that the result is just as I am wishing. Ask as many as questions you want.
Okay. So when something goes wrong, who feels it first? The patient, the body, or you?
Definitely, it is the body feeling first.
The body's.
The body is feeling it the first time because, after the surgery, I also listen to the body and I exactly tell the patient that you have to listen to your body. If there's something wrong you are feeling, it doesn't matter what it is. You have to tell me, or you have to, warn everyone around you. We are caring too much about what body says because body have to listen. It gives you signs. It's always giving you a sign or something that you have to understand.
So body alarms you.
Body alarms me, and also another thing that I have to explain is, body always likes the normal. Body has its own brain, you can call it. So it knows exactly when it is normal or when it is not normal. After the surgery, sometimes the body is fighting, okay? Like you cut everywhere and body is struggling and fighting to give all the effort to heal. But if you can give the body some healthy signs, like if you can walk properly, if you can eat properly, if you force yourself to eat properly and walk properly, and then voila, in 5 days you see that body heals itself very fast. Very fast.
Very fast.
Yes.
Tick tock, tick tock.
Yes, something like that.
When does surgery actually end? When you finish or when the patient accepts the result?
No, exactly. Immediately before the patient wakes up from the anesthesia, it is my call. If I am satisfied with the result, I end the surgery. If I'm not satisfied, I can start all over again until I got satisfied. But after 6 months or after 1 month, after 2 months, up according to the surgery, it is all patient's call. Okay, patient decides I'm satisfied or not.
So it depends on the patient.
Yeah, after a long time, before the patient wakes up from the anesthesia, it's definitely my call. After patient wakes up, after some time spent, it's definitely patient's call, of course, because it is aesthetic surgery. It's not some other surgeries like you have a tumor or we are operating. It's not something like that. Yes, safety first at any cost.
Okay.
Safety is sexy.
Do you think the body remembers what it looked like before?
Yes, it's a very good question because
thank you.
very good question because sometimes you have a deviated nose, okay? Your nose is like that from the scratch, from your birth. And you spend like 25 years like that. 25 years like that. Sorry for the curse.
F-word?
Yeah.
Really?
Sorry for the F-word.
I'm not even saying that.
Yeah. And then I, as a doctor, I'm trying to correct it on the operation table. And how much time do I spend for it? 4 hours, 5 hours, 3 hours, 6 hours? Anyway, so you are trying to correct a mistake which is there for 15 years in 2 hours. So of course it tries to remember, but we are giving all our effort for it to not to remember. And most of the time we are successful about that.
Wow, that was a philosophical answer, but
Yeah,
okay.
I think it is fine.
Okay. You have done the tummy tuck. One of your patients, we found it on the internet. Look at the photo. You're right here.
Yeah.
Did you do it?
Yes, I've done it a couple of months ago, I think. It was a patient from Iceland, like very big patient, height of 2 meters.
Are you producing your own carpet? Tell me.
No, of course, but
What
this
it
is,
is? What
this
is
is
it?
I accept that this is too much to remove. Personally, I don't really approve to remove this much amount most of the time, and I do not recommend. Sometimes I split these kind of operations into two, but for this patient, she has all the blood work and it was all normal, and then we could go for it. You know, as my team, we are very ordinated.
Big cutter.
Sorry?
Big cutter.
Big cutter, yes, but to do that, you have to really have a good team because everything have to be like
Proper.
yes, and you don't have to be you shouldn't be losing time in between the procedures because it's very crucial for me to end the operation under a certain time.
How many kgs does it weigh?
I think it was around 8 to 9, but I have to check.
9 kg.
9 maybe, I'm not sure about
So you can just get a tummy tuck and you lose almost 10 kg
yes,
in
but
one single session.
Yes, but this is most of the time applicable for post-bariatric patients because they have too much skin. If you are overweight and you have a little bit of saggy skin, but you have fat underneath your skin, first I do the liposuction, and by liposuction I can maybe remove 6 liters, 4 liters, 8 liters,
6 liters.
sometimes 8 liters, very rarely. And then after that I can remove 3 to 4 kilograms.
Okay.
But for this patient, she was like, she had lost all the weight she had to do. The only thing I had to do to cut off the skin, and I did that.
Okay.
And it's weighed like 10 kilograms.
Okay, thank you. That's all.
That's all.
Yes? I think it's enough. What do you think?
If you have any more questions, I
don't have any
more-
other more questions. Thank you, doctor.
Yeah,
Yeah, sure.
sure.
Of course.
You know, if you come to my office, you can stay like an hour and ask as many as questions you want.
No, I think I have the knowledge now. Thanks to you.
But just for the tummy tuck, for the next ones, next questions, and the other operations, you can come to me.
I will try.
I'm leaving
I will do my best.
right now.
Thank you. Yes, you
Okay.
please. Thank
Thanks.
you. Thank you.
They say it's self-love. You heard surgery. Honestly, same journey. Healing ends. Insecurity loves commitment.